The causes of lymphoma is usually not very clear. Age is generally not a common factor in the development of lymphoma. Lymphoma can happen in any age as well as gender. However, we are able to pinpoint certain factors that leads to someone developing lymphoma. For example, the first condition is when we have a genetic or DNA manipulation or mutation. So, for example, if someone is being exposed to any form of carcinogenic radiation that causes damage to their DNA, and that leads to the development of lymphoma. Number two, there are also risks when patients are exposed to infection and viruses, for example, Epstein-Barr virus, HTLV1. Once the patient is being infected with these viruses, this increases the risk of mutation in the genetic level, causing abnormal production of lymphocytes, which then leads to lymphoma. The third cause of the development of lymphoma is medical and environmental factors. For example, when someone is being exposed to chemicals during work or in their day-to-day activities, or for example, patients who had previous history of autoimmune diseases, where they've been exposed to treatments related to their autoimmune diseases, and that can then lead to a secondary cancer, which is lymphoma. Also, you have patients with reduced immunity, for example, in patients with immunodeficiency syndrome, where the immune system is very low, and that triggers someone into developing lymphoma. The last factor that helps in the development of lymphoma could be related to genetic or family inheritance. This is not very clear, but there seems to be some correlation with regards to family genetics in the development of lymphoma.